That's not normal.
No fun, no fun. Well, welcome, Kimberly. We are so glad to have you. Thanks for joining us today.
Good morning.
How are you doing?
Doing well. Just plugging along, right?
Yeah. Yes, yes. Thank you for joining us, Tim. We are glad to have you. I just got an email from you about helping out with veteran services, collecting information to help our veterans. So I think that's fantastic. That's a wonderful organization. Grateful to have you putting time and effort into that.
No problem. Thanks for having me here. If you could fill that out, that'd be great.
Yeah, I will definitely get that back over to you.
Okay.
Do you want to tell our group a little bit about that veterans organization and what it is that you are helping, assisting, collecting your information for?
Certainly. So, well, my name is Tim. I'm with Home Safety Services. And I don't know if everybody's aware of this, but throughout the country, there's a group called VCP. It's Veterans Community Partnership. They were initially started out as a hospice only group, but over the last, I'd say 2 years, the group has dropped their hospice requirement, and now it's open to all community business organizations. And the purpose and mission of the VCP is to gain information for the needs and issues of local veterans. And it tries to incorporate groups like home care, home health, obviously hospice, anybody that's involved or cares about veterans' interests. And each VCP, I belong to 5 of them, and they're strategically located throughout California, depending on where the hospital is. And each group is, they're not all the same. They have the same interests, but they're not set up all the same.
I'm on an important call, Ava.
Yeah, they try to present information on a monthly basis at meetings on veterans' concerns and veterans' benefits, things that have to do with veterans that people may not be aware of. And then each group also holds events, quarterly events, and those could be fun events, those could be educational events. The Veterans Benefit Panel that's held by each VCP is extremely well attended. It does a thorough investigation of all veterans benefits and how to access them. And it's a great resource for people in the community and their organizations.
Wonderful. That sounds like a great thing. If you wouldn't mind, Tim, if you have like a website or some contact information that you could put in the chat there for others who are interested in, helping to support and to be involved with those VCPs in the area, that would be fantastic. Or if you'd like, I can send out that request for information to the whole group that you sent over to me with the information, if you're okay with that.
Amy, that would probably be the best way doing it. And then I will put my email in the chat box. I'm sure people already have it, but feel free to contact me. There's a VCP in Sacramento that covers basically the Valley. Okay. There's a VCP in Palo Alto. There's a VCP in San Francisco. There's a VCP in the East Bay. There's one up in the North Bay. There's one in Redding, and I think one down in Fresno, but I'm not sure about that. So there's, it just depends on where your interests lie and where your geographic region takes you.
Wonderful. Well, thank you so much. We appreciate that, Tim. And I'll send that email out to everybody with information about that veterans organization, if you're interested in helping with that. Well, let's go ahead and get started. It looks like we've got lots of people who have logged on now, and we are at 10:05. But I just wanted to welcome everybody. Thank you so much for being here. Joyce, Fritz, who normally hosts this, she's not feeling well this week, and Julie Cosgrove is at a golfing tournament this morning. So I get to step in and be your host this morning, and grateful for that opportunity. We are growing in our membership. We're at 101 people who are on our Facebook page now. And it looks like we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, at least 10 people here today. In our meetings, they get recorded and they get sent out to the group so that people can get that information as well afterwards. But just wanted to do a little reminder to you guys to please help continuing to share and to get out information for people. We love the opportunity to be able to be a true help and resource to the seniors in our community here. And by letting people know about these resources that we talk about is a great way to do so. Our mission, just a reminder, is to proactively serve and educate each other in pursuit of synergistic solutions for seniors. And our vision is to create a unified senior resource team to support each other and the seniors that we serve. And our values are integrity, synergy, service, and collaboration. We're grateful for your guys and your support of that mission and that vision in your different ways. And are grateful to have Lisa Bargenquast, I hope I said that correctly, from Anthem Blue Cross team. And they are here to help us to understand and to learn more about Medicare 101. And so I will go ahead and I will turn the time over to you, Lisa, to let us know more about that.
You guys can hear me? Okay, all the head nods. Excellent. You probably heard me telling my daughter that I was on an important call. I'm so sorry. I didn't know the computer was on mute or not. I was trying to cover my mouth, so that was good. Got a household still all at home during the pandemic. I'm sure you all can understand. Missy's got a daughter in the background and all kinds of other stuff going on, so it makes life interesting. I'm sure you're all on the same page. We're all normal, right? This is life. So the new normal. I'd like to share my screen if that's okay. Okay. 1 second. Can you guys see my screen? Wait, I have to hit share. Now, can you see it? Okay,
Yes.
cool. So I don't want to go over everything, but I kind of want to give you guys a high level. And if we have questions, just anybody go ahead and chime in at any time if you have any questions. I also do have Rosa Padilla on the call too, and she's a direct field sales representative who is highly knowledgeable in Medicare 101, so she can also help with answering any kind of questions that you may have. So go ahead and speak up at any time, please. But like I said, I just wanted to give you guys a high level of Medicare. And I have a presentation put together that I kind of go over with individuals when we do either webinars or face-to-face presentations. So here we go. So I don't know if a lot of you are familiar with Medicare, but it is a federal insurance program administered by the CMS. CMS is an agency within the Department of Health and Human Services. Social Security offices process applications for Medicare, and it can also provide general information on the program. But what I would like to say is this is a process that individuals can go to. A lot of individuals use Social Security to get signed up with Medicare and ask questions. An individual will be assigned a social worker, is what the individual is called, and to go over any questions they have, get them approved, do all the paperwork. But what's really important is that with Anthem, we have specific support on site within an area that a senior might live in. So for instance, Rosa Padilla, she covers San Joaquin and Stanislaus County. So she can help individuals answer any kind of questions that they may have who are new to Medicare. A lot of our seniors are not familiar. I'm barely familiar just because I work in the industry with how the process works. It's very overwhelming for our seniors, let alone ourselves. You know, what's the process? What's parts A? What's parts B? What do I need to do? When do I need to do it? I mean, it's very overwhelming, and I cannot imagine for a senior too. And there's deadlines that you have to sign up by. So these are options. You can go to Social Security and get signed up, or you can talk to us and we can help an individual sign up directly, answer the questions that they have. We actually handhold our seniors through the whole process. We help them with Social Security getting signed up. Prior to the pandemic, some of my staff members would actually go to Social Security with the person and help them get signed up. Nowadays, we're on the phone, a 3-way call, and helping individuals get signed up directly. It's too confusing, it's overwhelming. So who's eligible? You need to be age 65 or older or under age 65 with permanent disabilities. If age 65 or older, you're eligible if you or your spouse worked and paid Social Security taxes for at least 40 quarters or 10 years. Or you're a permanent resident of the US or a legal citizen who's lived in the US for 5 years. Those are the parameters. There's some terminology. I won't go into this specifically, but this is a lot of terminology that some of you are already familiar with if you have health insurance, you know, benefits, provider, premiums, and deductibles. There's 4 parts to Medicare. Original Medicare Part A, which covers hospital, and Part B is medical. Part C is your Medicare Advantage plans, and prescription drug coverage is Part D. Before I move on, does anybody have any questions? Okay.
I have a quick question for you, Lisa. I guess I just
Yeah.
was curious with Medicare, if someone was a veteran and they had like VA medical benefits, would these two things kind of piggyback with each other? Or from a veteran's perspective, is there a reason to use one versus the other?
Yeah. So you can have both. And Medicare with Anthem, a private insurance company, can take care of other benefits that the VA does not cover, or what we like to call extras. I can go into more specifics, but they can have both. And it gives them the options to go see other doctors instead of just using the VA options, which a lot of individuals want to do.
Got it. Thanks.
So what is really important to understand what Original Medicare doesn't cover. Private insurance plans cover what Original Medicare doesn't cover, such as Anthem. For instance, Original Medicare doesn't cover Part D prescription drug coverage, such as deductibles and co-insurance, dental, vision, chiropractic services. There's a lot of different things that Medicare does not cover. For instance, like transportation. We provide over-the-counter products, no charge to the member. And there's a lot of other items as well. What Medicare does cover is Part A and Part B, which is hospital insurance, hospital stays, skilled nursing facility care, hospice care, some home health care. Part B covers doctor services, outpatient medical and surgical services, clinical lab tests, DME, and preventative services. So here's an idea of what Part A hospital insurance costs are for 2021. And Part B. And everything is based on your salary range. So you can see that your Part B cost, if you're 88,000 or less, could be 148.50. And you can see if you make more money, then your premium goes up. And here's an idea of what prescription drug costs are. And this is if you're paying on your own. So we're going to talk about also enrollment periods and what the best coverage is for an individual. And what's the time frames to decide. So in general, a senior has 7 months to enroll on the initial enrollment period. So that's 3 months prior to their birthday and 3 months after their birthday. And it includes the actual month of their birthday. So 3 months prior, say your birthday is, where are we at? Today is May. Say your birthday's in May. So you have 3 months prior to May, which I believe is February, March, April. Yeah. So you can sign up as early as February, or you can sign up 3 months after May, June, July, August. So you have until August to sign up on your 7 month. That's the initial enrollment period when you turn 65. Then there's the option of a special enrollment period. If you enroll in Part A later than 65, you may do so only during a general enrollment period or a special enrollment period. but you may have to pay a late penalty for Part A if you have Part B. So that's why it's really, really important to talk to someone, as I said, like Rosa Padilla, to go over when you need to sign up. Because if you do not sign up within specific timeframes, you will be penalized for the remainder of your life. Special enrollment period, if you're still working and have a group coverage or have coverage through a spouse, you can enroll anytime, still covered by the group plan through your employer or your husband's employer, or within 8 months of loss of coverage or employment, whichever happens first. There's another time frame that you need to sign up by without being penalized. GEP, everything's acronyms in healthcare, and you know all businesses use acronyms, so and healthcare does too. So GEP, General Enrollment Period. For those who do not sign up for Part B or Premium Part A during the initial enrollment period, you sign up through January 1st through March 31st annually, and your coverage begins July 1st. There's the penalty to apply lifetime, 10% for each 12 months eligible, but you did not enroll. So if you did not enroll, let's say you were supposed to enroll January of this year, by that date, then you would be charged however many months that you could have enrolled for the lifetime.
So Lisa, would that mean if you like waited 10 years, you would have almost like 100% penalty applied in your cost?
Yeah.
Wow.
Mm-hmm. It's not good. So what is AEP? This is the annual election period, October 15th through December 7th each month. You may switch to original Medicare during this time frame, or you can change your Medicare Advantage plan. So let's say a member decides to sign up, let's say with Alignment Health Plan or Kaiser or something like that, and they say, you know what, I want to try something different. This is the time frame when a person can change their health plan during annual election period. Most group insurances offer you, the time to change during a specific time of year. If let's say you have to add a family member to this, or you want to change your dental, or you want to add your vision or something like that. This is the same idea. This is a time frame that you can change your medical or healthcare options. Okay. The new coverage begins January 1st. Again, remember, whatever Medicare doesn't cover, what Medicare covers and what it doesn't. So it's really important to understand that. Deciding on the number of choices that the private insurance offers to enhance your Medicare coverage: Medicare Advantage plan, Medicare Supplement plan, and a prescription drug plan. So I'll go over those and the differences. Part B, things to consider. So you must have Part B if you want to join Medicare. If you want to join if you want to join a Medicare Advantage plan, you have to have Part B. If you want to buy a Medicare Supplement plan, you have to have Part B. You could also be eligible for TRICARE, which is a VA plan, or your employer coverage requires it. But you're still required to pay the 20% difference in coinsurance unless you purchase additional coverage such as Anthem. So if you only have Medicare, you still are going to have 20% of insurance to cover out of pocket. That's why it's truly important to get another insurance, a private insurance, to cover that 20%. So what is Medicare Advantage, which is also called Part C? It combines Medicare Part A and B, and sometimes Part D. It's offered through private insurance companies just like Anthem, and it often includes vision, dental, as I had stated before, like transportation, gym memberships, a lot of different extras. You must be enrolled in Medicare Parts A and B, and you must live in the service plan to receive access to Part C Medicare Advantage. What is Medicare Supplement? Again, you must be enrolled in Medicare Part A and B and be a resident in the state you want coverage in, and of 65 years of age to qualify due to certain disabilities. Medicare Supplement covers what Medicare Parts A and B do not, but you still have to buy a prescription drug coverage separately. Again, it's offered through Anthem, a private insurance company, and there's several different coverages under Supplement. So really high level, the difference between Medicare Advantage and a Medicare Supplement plan. Medicare Advantage, it usually has a very low premium, sometimes zero premiums, and Medicare Supplement plans usually have higher premiums, but you have the ability to see any doctor you want to. Whereas Medicare Advantage, it's more of an HMO type plan. You have specific doctors and hospitals and specialists that you have to see. Consider it HMO. Supplement any doctor you want to see. Both plans offer emergency coverage while traveling out of the United States. Here's some ideas about the different supplement plans. It goes from A to N. A lot of information, but we can go over that if you guys wanted to individually. So what's Part D? That's the prescription drug coverage available for all with Medicare Parts A and B, and it's purchased through a private insurance such as Anthem. It covers, as again, I said, prescription drug coverages, and you can also buy a standalone prescription drug plan. You can also purchase it through Medicare Advantage plan through the Part C. It can be combined into one, and a lot of times the plans that we have is a zero premium, which would include Parts A, B, and D. We also we can also assist individuals who are on Medicare and Medi-Cal, and they can receive extra assistance, what's called the Medicare Savings program and extra help. So we can help individuals get them signed up on receiving access to not having to pay for any kind of premiums, any kind of co-payments, anything like that, and receive all the extra benefits too. You automatically qualify for these things if you have Medicare and full Medicaid, supplemental security income, or help from a Medicare Savings programs. Individuals can also receive help in paying for their Part D prescription drug coverages. A lot of times individuals only have to pay $1 to $2 for their prescription drug coverage if they qualify. So individuals sometimes like to carry less cards, and this is important to them. And if they wanted to have a Medicare Advantage plan, they would only have one card instead of having to carry a Medicare card, Medi-Cal card, prescription drug card. Again, what's the right plan for you, whether it's a Medicare Advantage or a Medicare Supplement? It's just about, a lot of times it's about cost and access to doctors. Those are the two biggest choices in deciding. Again, showing you the decisions about making, whether you want one card, two cards, or three. Deciding when to enroll. It's important to talk to somebody that's licensed, understands the process. Like I said, Rosa Padilla is our individual who can help individuals understand, educate, and go over what's the process. Medicare is a health insurance program. It doesn't cover all of your healthcare costs, so that's what's really important. It only covers 80% of your insurance. Does anybody have any questions? I know I went through this pretty quickly and I did a very high level education on this. So please, let me stop sharing.
This is Cindy. I do have a question. Like, boy, this stuff is confusing if you're not in the middle of it. So if someone, maybe they're still working, they have a group plan, or they have Kaiser, or they have something else, when they turn 65, let's just say they're working till they're 70, are they going to get penalized if they don't sign up for it, if they've got some other coverage, you know, or is that the special enrollment thing? And I guess basically say they have some other coverage until 70 and that's when they want to sign up, do they then get penalized?
Rosa, would you like to speak?
Can you hear me now?
Yeah, we can hear you.
Yeah. Okay. So, yeah, we have a lot of people that are actually working until age 70 or past their 65th birthday. When they have credible coverage through their employer, they can opt out to get to not get the Part B. They can get Part A because Part A of the Medicare is free of charge. They can get that, and they can choose to opt out or enroll in at a later time for Part B. When they are ready to retire, let's say in the next 4 months, then they can start the process of getting their Part B. So they can activate their Part B, and then they can go ahead and enroll into either a supplement or a Medicare Advantage plan to make that Medicare card complete. One of the things that Social Security doesn't always specify is that they need a Part D for their prescription coverage, and if they do not get their Part D, there's also a penalty for that. So yes, they can choose to not get their Part B until they're ready to retire. Does that make sense?
Yes, thank you.
Rosa, did you say how long they have before they decide not to use their employer insurance?
If they, let's say they plan to retire in December, I always tell them at least 3 months prior, talk to your human resources and tell them that, you know, you're going to be retiring in December. What is the process to actually either am I going to keep my employer insurance, or do I need to activate my Part B and start my process for the Medicare Advantage plan or the supplemental plan? So it's very important to talk to HR. I would say at least 3 or 4 months prior to your retirement month.
Thank you.
Lisa, this is Tim. Thank you for the presentation. I was wondering, can we get the slides for this presentation?
I'll see what I can do. I don't think it's a problem, but I can also get you information,
Okay.
like
And
booklets, Medicare 101 booklets too.
that'd be great. A follow-up question in regards to the MA benefits. In 2019, CMS included several other options to the MA, like meal delivery, case management, home modifications, and there's a couple other ones. But the providers, Anthem, Blue Cross across the country, has been slow to implement those changes or include those new benefits. And I'm curious, what do the providers of these services need to do to help with the providers to make those inclusions?
Rosa, I mean, I know that we're providing meals to all of our chronic conditions up to 90 days. I know that we're
the
doing.
most important, the key is that the member needs to talk to their PCP, their primary care physician, so that way the primary care physician is aware of his needs, and then they could do a referral. So the referral process needs to happen. And usually within Anthem, the referral takes between 3 to 10 days.
Okay.
If we can't find the specialty within the area that the member is living in, we do approve outside of the area. So, for instance, I have a member. He gets epileptic seizures, and he goes all the way to Stanford, and he visits his doctor in Stanford for that specialty.
Okay, I'm not sure, maybe I wasn't clear enough. So under the Medicare Advantage program in 2019, CMS okayed other types of benefits. And since 2019, only a handful, I think 1 or 2 of those benefits have been included in your product offerings. So my question is, what do the providers of those product offerings, and be perfectly blunt, Home Safety Services provides home modifications. Home modifications was included in the MA CMS inclusion statement, but nowhere in the United States, to my knowledge, are home modifications included in the Anthem or Blue Cross or Kaiser or any of the other MA offerings. It's not, they're not there. So my question is, what do we need to do to put some pressure on Anthem to start including those benefits that have been okayed in the MA statement?
Yeah, I can look into that because I'm not aware of the home modification guidelines that have been changed that you're talking about.
I can send you the CMS recommendation and the upgrade to the MA statement if you'd like.
Okay. Are you sure it's a MA or is it a Medicare?
It's Medicare
Guideline.
Advantage.
Okay.
Yeah.
Yeah. If you could get that to me, that'd be great.
Could you put your email in the chat?
Yeah.
We have pest control, but the home modifications, I have not heard of that.
So there was about 5 new benefits that were included in that statement, and meal delivery was one of them. Home modifications, and then I think there was 3 other ones too.
Yeah, I know the meal delivery is done, and we're doing that. Like I said, we're doing that to all the chronic members for 90 days, healthy meals that are delivered to them. And I know we've been offering it to individuals who are Anthem members, period, especially during the pandemic. But please get me that information and I'll see what I can find out, and then I can get back to you about it.
That's a great question.
That's a great question.
Yeah, wonderful. Anybody else have any more questions for Lisa or Rosa while we've got them here? The wonderful wealth of information for sure.
Yeah, and you guys can contact me or Rosa anytime. I'll put her information in here too, because it's a lot of information that's overwhelming.
Yeah, I guess my takeaway from this is if you're getting near 65, that you need to get in contact one-on-one with somebody, because everyone's situation is a little unique, right? Whether you're continuing working and you're going to have some health insurance or not, or VA benefits or other types of things in play, that you do want to have a plan of what you're doing with Medicaid to avoid that Medicare, the penalties that come into play. I had no idea that if you didn't kind of have your plan in place by the time you're about to turn 65, that you could have some financial repercussions that you're not realizing for the rest of your life, you know.
Exactly. I mean, the penalty is the biggest thing that you need to be concerned about. So when to sign up and how is extremely important for individuals. So if you guys, I know you are interested in all this information, but if you guys have other individuals that are interested, please have them contact myself or Rosa directly. I can get you guys business cards, flyers, whatever you need to give to yourself or friends, anybody. Because lots of people, I mean, we have a huge community of people that are going into, you know, baby boomers and whatnot are already in this situation. One thing I want you guys keep in mind too is even if you have a plan with Anthem or Kaiser or anybody right now and you're paying with your group insurance, your premiums are a lot higher than what you could get access to with us right now. As I said, zero premiums to no, you know, low premiums to zero premiums, or a supplement plan around $150 to see any doctor you want. You know, most of your group plans are paying, I know I'm paying astronomical amounts of money. And as a senior, we don't have as much money and we're paying prescription drugs and whatnot as we get older too. So it's really important to see how you can lower that cost as much as you can. So
Yeah.
let us know. Any questions, call us, whatever, or email. I have my information in there.
Yeah, thank you, Lisa. I think that's definitely something anyone I know getting older that I would pass along your information and say, you know, have a one-on-one consultation. You want to talk to these guys and find out what's the best plan for you for the future.
Yeah.
Sure.
And one other thing I'll say is that a lot of times we have the same doctors that they're already seeing. So it's just an easy transition. So.
And then if any of you guys know of any senior apartment complexes or any groups where any of our sales reps can go in and do a Medicare 101 in person now that we're opening back up and things, that's something that we do like to do just for the informational purposes more than anything, because there is so much information and things that people don't know, especially for those who are aging in that don't know about the penalties and the prescription drug plan and all that stuff. So you can email myself, Lisa, or Rosa, and we can schedule something in a group setting too.
Yeah. The other thing that we're doing, just to give you an idea right now, because we're trying to get in front of seniors and it's been very difficult during the pandemic, but we're trying to go to senior apartments right now. And we're scheduling what we call ice cream socials, or we're doing what we like to call silver sneakers, is the gym, you know, for seniors, and they can go to any gym they want to. But now we're going directly to the senior apartment complexes and we're providing a workout routine out in the parking lot so they can get out and get some fresh air and we can exercise together and try to just, you know, give some kind of community, you know, involvement, and it's so healthy for them.
Ladies, I think that what you're doing is a fabulous idea. We have a new complex that's being constructed right now in Oakdale, California, and I'm not sure if you know about that. It's by our Rite Aid, which is on the west side of town. So I do not know the name of it at this point, but it's going up really fast, and that might be a good place to do it. As well as I sent a little something to Amy at the church once a month in Oakdale. The Catholic Church, St. Mary's. I'm just starting to participate in a volunteer for food, and they give away a lot of food, and that might be a good place to, you know, just have your business card sitting out.
Yeah, we're doing a lot of volunteering at churches and food distribution centers. We're participating at the Salvation Army's food distributions too. So if you have someone we can contact at St. Mary's, let us know. We're trying to help out wherever we can, in the churches, whatever it is. You're on mute.
Yeah, actually, I do have a contact for you, a gal that is organizing this. Her name is Kim Paulus, and she works for the Catholic Charities Association in Stockton. So I will get that information to Amy.
I actually have been talking with her because I'm doing a vendor event here, and So
Perfect.
I'll ask her about that's awesome. Thank you.
She's very much involved in assisting the elderly in this area. So good
Wonderful.
contact.
Yeah, wonderful.
I think
What's
it would be, oh, go ahead, Lisa.
Oh, sorry. Misty, you might already know this, but Crystal, what's the general population at St. Mary's Church?
You know,
As
I
far
do
as-
not know. I do not know that information. Kim will have that for you.
Okay.
I was just going to say, maybe in conjunction with something like that at St. Mary's Church, it might be neat to organize a senior event. Maybe have something where they could do like the Silver Sneakers, have like a little exercise activity that could be done there, and then we could also have people like Tim and some of the service providers that do things for seniors that they might not be aware of. There at that event, to be able to share their information with them, but just to have kind of like a senior specific event where there's already something that's happening, just kind of like piggyback on an informational, like a helpful event, providing food, providing some exercise, providing information, some things for seniors. So it's kind of
That's exactly what I'm putting together now. I have one in Stockton for June 19th, and then I'm planning one for August 27th at the Salvation Army site on Vegas Street in Modesto. So, and I will put on as many as you guys want me to. So I'm actually looking for vendors and participants for the August 27th one. I was going to send out an email. I kind of wanted to get through the June 19th one, but it's good to mention. So yes, and we would love to do them at churches and anywhere that they'll let us come in and be on site. And I want to get as many resources from all of you guys and anyone in the community for the seniors to have access to. So yeah, that's awesome.
Yeah, for sure.
And if we can collaborate together, then we can work, do more for the community, I'm sure. So like if you're providing food distributions, then we can bring other resources available too.
Yeah, definitely.
So.
I think just
Yeah.
people know what is available. Like for me, it's just like, oh, I didn't realize everybody really should have a one-on-one, Medicare person to be helping them through this process. I hadn't even thought about that, how complicated it is and how timely and important it is for seniors to get this information, to not be penalized the rest of their lives, just realizing that information is super powerful and being able to provide those things in an easy format in person, thankfully, getting my vaccine on Saturday. So being able to do those things for people in person, it'll be nice to all of this foundational thing we've been doing throughout the pandemic, meeting with Zoom, getting to know each other and finding out about resources. It'll be so nice to in person put these things into effect and to be able to
And I feel bad for seniors if they do have to go to Social Security, because I kind of feel like it's DMV, type of mentality.
I had to do that with signing up for Social Security for Ron, and he is a combat veteran, and it was a nightmare. But we did get hooked up with somebody who knew what she was doing. Otherwise, we would have been penalized. So getting this word out is very important. I'd like to also say something to Tim. I got your email this morning, Tim, if you're still with us. And I could probably, confer with you on some of this information and maybe bring some of that information that you have to these food distributions once a month.
Yeah, that'd be great. Let me know where I can send some information to you.
Yes, you already sent me an email this morning, and I did receive that, and I sent you a note back, so you have my email now.
Okay, that was in regards to the VCP needs assessment form.
Right, correct.
Yeah.
Yeah, definitely. Well, Crystal, if you want to talk to Kim, if there would be a good time to do like an Oakdale in person, kind of like senior support day, in conjunction with their food distribution, then if we can even just kind of see if there's a good date on the calendar to do that in the next several months, then we can start getting the word out to people and see what resources we can pull in there to help and be more supportive of something they're already doing.
And better yet, let's see if I can get her on this call.
Even better. That would be fantastic.
I'll work on that.
Okay, definitely. Well, thank you all so much. Thank you, Lisa. Thank you, Rosa, for your time, and Misty for helping to get all of this good information out to everybody, and for Crystal for bringing in additional resources so that we know about things in our area, and Tim getting the word out for our veterans. I really appreciate it. Like I said, I feel like that a lot of groundwork and things that, people have been doing, it's neat to see them starting to, synergistically come together and finding even more ways that we can really help and support our seniors. And what a blessing to be able to do that in our communities right now. I think we all have like a deeper appreciation of how important community is, having had so many parts of those so limited over the past year, and just a deeper drive and an even stronger conviction that as it opens up, I will be a part of supporting my community. I will be a part of reaching out and helping those around me, with the time and the freedom to move and to interact that we've been given back, that we will take advantage of those things and, be more helpful and supportive to those who need it most, especially who have probably suffered some of the most throughout this pandemic in our senior community.
Which is our seniors.
Yeah.
It's really sad.
Yeah, for sure.
Well, thank you, Amy, very much.
Thank you.
And Lisa and Misty, you've really included a lot of information, as well as Tim. I wish goodwill to Joyce. Let her know we're thinking of her.
Thank you. Yeah, prayers are appreciated, as she is, not feeling well right now. Thank you so much.
All right, ladies, have a great
Thank you,
day.
ladies. And
Thank
Tim.
You guys have a wonderful time. There is the emails that are up there for anyone that needs them in the chat, and I will email those out as well to everybody so that you've got those. Thank you.
Thank you.
Bye-bye.
Bye, everybody.
Bye.